Hi, everyone. Welcome to the MedCloud Insider Podcast, a monthly recap of the top stories published in our online industry news magazine for IT professionals and developers in the medical and healthcare community in the U.S. I'm John K. Waters, Editor in Chief.
And I'm Gladys Rama, Editorial Director. We have a lot to talk about in this episode. First up, we have a partnership between GE Healthcare and Nvidia. They just announced an expansion of their collaboration to develop autonomous X-ray and ultrasound systems. What's the story here, John?
GE Healthcare made the announcement at NVIDIA's GTC 2025 conference in San Jose. The premise behind this partnership is addressing something that's becoming a huge problem in healthcare, the shortage of radiology staff.
I've heard about staffing shortages in healthcare, but how bad is it specifically in radiology?
It's getting pretty serious, actually. With the aging population and more people needing medical imaging than ever before, many health systems are really struggling to keep up with demand. Radiologists, technicians, they're all being stretched thin, and that's where this AI partnership comes in.
So they're basically developing AI to help fill the gap?
Exactly. But not just to fill gaps, it's also about making the whole imaging workflow more efficient. GE Healthcare is leveraging NVIDIA's new Isaac for Healthcare platform, which includes some pretty amazing tech. The NVIDIA Omniverse for robotic simulation and their Cosmos platform for synthetic data generation.
Wait, back up a second. Synthetic data generation, what's that about?
Instead of needing thousands of real world X rays to train their AI systems, they can create realistic simulated images. This platform also uses physics based sensor simulation, imitation learning, and reinforcement learning to train these autonomous systems in a virtual environment before they ever touch a real patient.
They're essentially practicing in a simulation?
It's like a flight simulator, but for medical robots. They can test and refine everything virtually, work out all the kinks, and then deploy it safely in the real world. Roland Rott, who's the president of imaging at GE Healthcare, mentioned that this builds on their deep history of firsts in medical imaging. The first focus is on developing an autonomous X ray system using NVIDIA's Isaac for Healthcare and Jetson platforms. The idea is to free up healthcare professionals so they can focus more on direct patient care and complex cases that really need human expertise. The AI powered systems could assist with image acquisition and robotic navigation, handling the routine imaging tasks while minimizing that repetitive strain. And this isn't their first rodeo together. GE Healthcare and NVIDIA have collaborated before on AI medical solutions, including something called Sono Samtrack, which was trained on about 200,000 image mask pairs.
Do we know when these systems might actually be available in hospitals?
They haven't given specific timelines yet, but um, Kimberly Powell from NVIDIA mentioned that they're looking to accelerate the future of medical imaging capabilities, starting with X ray and ultrasound, since they're the two most widely used modalities. The goal is pretty ambitious. They want to expand global access to advanced imaging systems, which could be huge for underserved areas.
What about costs? Healthcare technology isn't exactly known for being affordable.
Yeah, the initial investment will be significant, no doubt, but GE and Nvidia are betting on long-term savings. Fewer repeat scans due to positioning errors, faster throughput of patients, reduced workplace injuries for staff, and more efficient use of specialist time. All of these could potentially offset the initial costs and maybe even reduce the price per scan eventually.
So, this AMIE model, the Articulate Medical Intelligence Explorer, is something I've been dying to talk about. It's taking AI in healthcare to a whole new level beyond just diagnosis, right?
AMIE is actually moving into the realm of disease management and treatment planning, not just spotting what's wrong. It's like the difference between an AI that can identify a car problem versus one that can actually tell you how to fix it and maintain your vehicle over time.
That's fascinating. How exactly does it compare to what human doctors are doing now?
So the researchers put AMIE through this randomized study where they tested it against 20 primary care physicians across 100 multi visit patient cases. And what's really impressive is that AMIE matched or even exceeded the clinician's reasoning in these consultations. We're talking about planning investigations, recommending treatments, writing prescriptions, the whole package.
Wait, so it's not just handling one off visits, but actually following patients over time?
Exactly. That's what makes this so different from earlier medical AI systems. AMIE can remember previous interactions with patients, track how symptoms evolve, and adjust treatment plans accordingly. Clinical reasoning isn't just about making a diagnosis, it's this complex process of understanding disease progression, medication safety, and applying clinical guidelines while working with patients.
I'm curious about how they even tested something like this. It seems so complex to evaluate.
They use this really clever approach with a structured clinical examination model, kind of like how we evaluate medical students, and they had specialist physicians assess AMIE based on things like guideline adherence, patient centeredness, and whether the treatments were appropriate. They even developed a new evaluation system they're calling Management Reasoning Empirical Key Features to specifically measure AI driven management reasoning.
So, what's the secret sauce here? How does Amy actually work?
It's built on the Gemini family of AI models, but with some special capabilities optimized for clinical reasoning. It has this advanced long context processing, which means it can remember and process much longer patient histories. And they've worked really hard to minimize hallucinations, those made up facts that AI sometimes generates. They also designed AMIE with this two agent system that mirrors how human clinicians approach patient care. There's a dialogue agent that handles the patient interactions, making sure communication is empathetic and natural. And then there's a management reasoning agent that does the heavy lifting of synthesizing medical knowledge and patient history to create structured treatment plans.
I have to ask, how does it handle medications? That seems like a particularly high risk area.
They created a whole new benchmarking system called RxQA with 600 multiple choice questions based on drug formularies from the FDA and British National Formulary. It was validated by board certified pharmacists and tests AMI's ability to reason about medication indications, contraindications, dosages, side effects, and interactions. It's a critical safety check before something like this could ever be used in real clinical settings. The researchers also built it to mirror how human doctors approach patient care with this two agent system that divides the responsibilities in a really intuitive way.
Two agents, so it's basically like two different AI systems working together.
Exactly. So the first one is what they call the dialogue agent, and its whole job is to, well, handle the patient interactions. It's designed to communicate in this really natural, empathetic way, asking questions, explaining concepts in plain language, and making patients feel heard. It's like it's the bedside manner part of the doctor's job, right?
That makes sense. Patients need to feel comfortable enough to share information.
And then the second part, this is where it gets really sophisticated, is the management reasoning agent, or what they call the MX agent. This is the behind the scenes brain power that's doing all the complex medical reasoning. It's taking everything from the patient's history, current symptoms, lab results, and then combining that with its vast medical knowledge to generate structured treatment plans.
So one agent talks to the patient and the other one figures out what to do.
That's that's pretty much it, yeah. And what's fascinating is how they work together. The dialogue agent gathers information from the patient and passes it to the MX agent, which analyzes it and develops a plan. Then the dialogue agent takes that plan and communicates it back to the patient in a way they can understand.
It's so interesting how we're moving beyond just diagnosis with these medical AI systems.
It really is. The shift from can AI diagnose this condition to can AI help manage this condition over time is it's a huge leap forward. It suggests we're getting closer to AI that can support the full spectrum of clinical care, not just isolated decisions. Speaking of AI supporting clinical care, have you seen the news about Fair Health's new AI platform?
I have. Fair Health just launched this free shared decision-making tool specifically designed for Alzheimer's patients and their families. And it's really quite comprehensive.
So, what exactly does it do? I mean, Alzheimer's is such a complex disease to manage.
That's exactly the challenge they're trying to address. See, Fair Health has this massive database of health insurance claims, probably one of the largest in the country, and they're leveraging that data along with AI to help guide patients through the whole journey. The tool provides detailed information about treatment options, the costs associated with different approaches, and even self care strategies that patients and caregivers can implement.
That sounds incredibly useful. I imagine cost is a huge concern for families dealing with Alzheimer's.
The financial burden can be, well, overwhelming, frankly. What's really cool about this platform is that it includes something called the FH Total Treatment Cost Tool, which helps families estimate and plan for expenses. And it's not just about medications, it covers the whole spectrum of care needs.
What kind of self care guidance does it provide? I mean, beyond medications.
It's actually quite comprehensive in that area too. There's information about healthy diet planning, physical exercise routines that are appropriate for older adults, brain stimulating activities to help maintain cognitive function, and even processes for reviewing medications to avoid harmful interactions. All these things that can make a real difference in quality of life for someone with Alzheimer's.
That's that's really comprehensive. But I'm wondering, is this actually accessible for older adults who might not be that tech savvy?
They've really thought about that. The platform is bilingual, available in both English and Spanish, and they've included these printable checklists that can be used offline. So, like a caregiver could print out a checklist to track cognitive changes or prepare questions for a doctor's visit.
I'm guessing this was developed with some serious clinical input.
Oh, for sure. It was developed as part of a national initiative funded by the John A. Hartford Foundation, and they've designed it to align with what's called the 4M's framework of age friendly care, focusing on what matters to patients, medication management, mind health, and mobility support. It's it's really grounded in best practices.
And are doctors actually using this with patients, or is it more of a direct to consumer tool?
Both, actually. While anyone can access it through fairhealtholderadults.org, they're also working with clinicians at four age friendly health systems. Places like the University of Pennsylvania, Ohio State, University of Rochester Medical Center, and Emory. These institutions are actively integrating the tool into patient consultations, which is pretty significant for adoption.
What's their reach looking like?
They've set some ambitious goals. Fair Health is aiming to engage about 40,000 website users directly and potentially reach up to 10 million people with these tools. It's part of a broader effort to empower patients and caregivers with better information. And that's where I think this tool really shines. Caregivers can use the checklists to track day to day changes that might be hard to remember by the time a doctor's appointment comes around. They can estimate costs for different care approaches using the FH Total Treatment Cost tool, and they can access resources specifically for caregiver support, which is honestly, it's crucial because caregiver burnout is a real concern with Alzheimer's.
So, there's a common thread running through the three AI developments we've discussed today, don't you think?
Yeah, absolutely. When you step back and look at the big picture, what we're seeing is AI evolving beyond just like analyzing data or making predictions. It's now actively participating in healthcare delivery in really meaningful ways.
Right. We've got GE and Nvidia building autonomous imaging systems, AMIE making complex medical decisions, and Fair Health creating patient facing tools. They're all so different, but they're all pushing healthcare AI into new territory.
It's about using AI for the things machines do well, like pattern recognition and processing vast amounts of data.
Looking ahead, what do you think the next frontier is for healthcare AI?
I think we're going to see more integration across these different types of systems. Imagine if Amy's clinical reasoning capabilities were connected to autonomous imaging systems and patient facing tools. You'd have this comprehensive ecosystem where AI supports every stage of the healthcare journey while still keeping humans at the center of care.
And that's it for this edition of the MedCloud Insider Podcast.
If you enjoyed this episode, be sure to subscribe wherever you get your podcasts. And if you have thoughts on any of the AI healthcare technologies we discussed today, we'd love to hear from you. You can reach us through our website at MedCloudInsider.com.
We'll catch you next time with more insights from the cutting edge of healthcare technology. Bye for now.
See you next time.